Hello, I'm Dr. Daniel Farkas, and I want to talk today about female hormone natural support and solutions. This information within this presentation is for informational purposes only. Do not start, alter, or stop any treatment regimen without physician supervision. So again, I'm Dr. Daniel Farkas, DC CFMP. I'm a physician certified as a functional medicine practitioner, serving clients nationwide since 2004. These days I use virtual capabilities for those within the state of Michigan. I'm also a professional speaker and a physician educator, and I work with advanced testing and in the development of natural products. Now, let's talk about hormones. Let's get an introduction to hormones. Just understand that maintaining hormone balance, it's crucial for feeling and functioning optimally. Hormone levels change at different points during the female life cycle, and it's crucial to understand the different issues and patterns that can arise and how to apply effective natural support. So, know your hormone types. There are three. The sex hormones, estrogen and progesterone, those are the female hormones, and the male hormone testosterone, those are the sex hormones. Next, the thyroid hormones, made by the thyroid gland in the front of your throat, and cortisol, the stress hormone made by the adrenal glands, two little glands that sit just on top of your kidneys. I want you to think about this as we move through here in terms of a tripod of hormonal balance. Three legs, the three classes of hormones, all same, the legs the same length, strength, everything. A nice balanced table, a nice balanced tripod of sex hormones, thyroid hormones, and cortisol. So let's talk about the stress hormones, what they do. Estrogen, very powerful, big mouth hormone, I say. Estrogen, it's responsible for female reproductive health and the development of secondary sex characteristics. The progesterone, it helps with fertility, maintaining pregnancy, and regulates the menstrual cycle. Now, testosterone, it's important for bone and muscle health and contributes to sex drive and our ability to be focused and to accomplish goals. Very important. The thyroid hormones made by the thyroid gland, they're needed by every cell in your body to make energy. Your thyroid makes something called T4. That T4 moves through your body and gets turned into T3. Now, understand that pretty much every cell in your body needs T3 in order to make energy, just like every car needs either gas or electricity to go. Now, cortisol, it's the stress hormone, and just know that cortisol is your friend. It is not your enemy. It's created by the adrenal glands that sit just above the kidneys. And cortisol is your backup plan if blood sugar is not sufficient. Always got to have a backup plan. So again, what do we want? A tripod of hormonal balance of the sex hormones, thyroid hormones, and the stress hormone cortisol. But there are some problems that can happen in what I call patterns. There's an early pattern and a later pattern of problems. The early pattern, it strikes the late teens, to the 20s, 30s, and into the 40s. It can affect puberty, fertility, skin, pregnancy, breastfeeding, and cause postpartum issues. The later pattern, known as change of life, into the 40s and 50s. This is where sex hormone production decreases, and this puts intense stress on the thyroid and on cortisol production. Just imagine one of those three legs of that tripod of balance just gets kicked out. Just imagine that and what happens. Now let's talk about the early pattern and the hormonal changes that can occur during the childbearing years. Again, this is late teens to the 20s, 30s, and into the 40s. You can see issues with skin problems, cycle issues, mood, emotional issues, fertility problems, PCOS, known as polycystic ovarian syndrome. I'll explain more soon. And issues with pregnancy, breastfeeding, and of course postpartum issues. So again, some of these early pattern problems, you're going to see issues with skin, oftentimes acne, mood, not where it should be, premenstrual syndrome, PMS, fertility problems, PCOS, and just understand this. So much of this is driven by genetics, and environmental toxins and stress just aggravate it. No one's genes are perfect. We get them from our parents. We can't pick them. But our weaknesses can get aggravated and egged on by environmental toxins and stress. Just know that. Now, the hormonal changes like during pregnancy, of course, and related to pregnancy, of course, fertility issues, huge concern. The support during pregnancy and breastfeeding, when the sex hormones are fluctuating, the thyroid and the adrenal glands, they have trouble keeping up with support. And of course, there are those postpartum stubborn imbalances that appear and sometimes have a difficult time being eradicated. So when it comes to skin and acne, we talk about a few different types. Cystic acne, the deep bumps along the jawline, the neck, the back of the arms, the cheek acne that's typically pimples caused by oftentimes poor estrogen clearance, and then there's the T-zone acne, the forehead and the bridge of the nose. That may be due to food sensitivities. So I just want to talk about PCOS because it's such a big deal and it's so common these days. There are 3 parts. Number 1, the cysts on the ovaries. These are visualized by ultrasound. Number 2, male hormone dominance. This can result in that cystic acne on the jawline, the sides of the neck, and the back of the arms. And so much of PCOS, follow me here, is driven by insulin resistance. And what is diabetes and prediabetes? It's insulin resistance. This has so much to do with blood sugar and weight. And look down there at the bottom, PCOS, top reason for infertility. Let's talk about the later pattern, then we're going to tie the later pattern and the early pattern together here in just a bit. But menopause and the later pattern, known as change of life into the 40s and 50s. This is where the sex hormone production decreases, fluctuates wildly sometimes, and an intense stress is placed on the thyroid and on cortisol production. Some of the later pattern problems are emotional fluctuations, hot flashes, thyroid stress, cortisol stress, of course, weight gain, hair loss, mental focus decline. And remember, so much of this is driven by genetics and egged on by environmental toxins and stress. So what to do? What can we do about this? The early pattern and the later pattern. Like, what can we do? We can use medication to force balance. Sometimes it's necessary to preserve life and basic function. I'm not against medication use when and where it's indicated and appropriate. Always follow the recommendations from your managing physician, of course. The problem is it's just not the preferred course of action. It doesn't usually address the cause, just treats the symptom, which is necessary sometimes, but there are typically side effects. And the costs can be high, and they can be ongoing. So I'll just let you know there's a new advanced approach to addressing the early pattern and the later pattern. Remember what are hormone types, sex hormones, thyroid hormones, cortisol patterns. Let's talk about assessing these and getting some advanced information. Now, when it comes to just total complete thyroid testing, I'm a huge fan of this. This can be done in an ordinary lab, gratefully. I feel that it must include not just the TSH, the thyroid stimulating hormone, but I think looking at the T4, the T3, as well as both thyroid antibodies called TAB and TPO is crucial. TSH, that's the ordinary thing that they typically check for. If that comes back normal, they usually stop right there. But by assessing the T4, which is the actual stuff that's made by the thyroid, and the T3, remember, the T4 gets converted into T3, and pretty much every cell in your body needs T3 for energy. Super important to know all those. And then it's also very crucial to know whether or not we have an elevation of what's called the thyroid antibodies, TAB and TPO. These are signs that, unfortunately, the immune system has declared war against the thyroid. One of the most common autoimmune conditions. It's got to be charted, I feel. Oh, here's a pro tip. Check your insulin every time you can. PCOS, prediabetes, super important to keep an eye on that. As well as other blood sugar factors like fasting glucose, HbA1c are important, but that insulin, I think, is really crucial. Now, I want to pull the curtain back on some advanced assessment of the sex and stress hormones. And it's called dried urine testing. This measures sex and stress hormone levels, yes, but also their ingredients, the things that makes them, and their byproducts, all the stuff that's left over after they're used up. It charts what's called the cortisol curve. Now, the stress hormone cortisol, ideally it should be pretty high in the morning, about the time you get up, and by noon it should come down low and stay low. By noon, it should come down low and stay low. But just imagine if you just got one sample on a random time of the day of cortisol, you wouldn't be able to chart that curve. That's why I'm a fan of advanced dried urine testing. Dried urine testing shows right where the weaknesses are in the sex and stress hormone metabolism. And like I said at the bottom, it captures 4 samples on a specific day of your cycle or on a day of average stress if you're not cycling. Just advanced information. Have you seen this before? Have you seen something like this? This is a report of dried urine testing. This is what one of the reports looks like. This would be the most common one. At the top, we can see the sex hormones. We see 3 dials. The first one is what's called estradiol. That's estrogen. This finding is terribly low, not good. Next comes progesterone. And then finally, testosterone, the male hormone on the right. This person definitely needs some support. Now, below in the bottom left, we can see a graph that shows in red the daily free cortisol pattern. We see a few lines. We see the high range limit in black, the lower line, the low range limit, and the actual patient values from 4 dried urine samples taken on a specific day of the cycle and taken during a day of average stress. To the right there, we can actually see how much cortisol is being produced. But of crucial information, follow me here, look to the right there. You can see a dial that's very, very low in the bottom right corner of this page, listed at 2725. That is the end result of used up cortisol. To me, this is a strong indicator that this person's their cortisol production is just really not meeting the demands of the body. They could benefit from some support. And then just above that is a dial that says 663. It's just barely hanging in there, pretty low range. That's also made by the adrenal glands. This person needs some adrenal support and some estrogen support, certainly. Advanced testing gives advanced information. It's all about more info. When you get more info and you can see the functionality of what's working or not working, it can tell us what to do from a natural standpoint, and also when people truly do need medication too as well. So what do? We've measured the thyroid, the sex, and the stress hormones. We got this nice big thyroid panel done. We have dried urine results. Like, what do we do? Like, how can we support? Here are some ideas. Everyone's unique, but here are some general ideas about what can be done. It's all about support, getting assistance from a professional, and making sure that you have their guidance through the process. Everyone wants the natural approach. I'll just let you know it's available, but I think it's person and condition specific. You will find commonalities in some people who have the early pattern, who are about that age, and commonalities in people with the later patterns. But remember, I think it's got to be person and condition specific. No cookie cutters. So what to do with the early pattern for skin, cycle, mood, emotional, fertility issues, pregnancy, breastfeeding, and postpartum issues? What can be done? Well, skin support for cheek acne can be estrogen detox support using Vitex berries, DIM, and avoiding toxic estrogen impersonators. This is crucial. Gut health to support estrogen elimination. It's a big complication when constipation or irritable bowel syndrome, inflammatory bowel syndrome, bacterial overgrowth, acid reflux. When that comes into play, it typically can affect estrogen detox. It's important that that gets addressed. Now, we got to support the liver, too, to ensure that estrogen's eliminated properly, too. This can help support cheek acne. How about the cystic acne? Skin support for cystic acne can consist of testosterone detox support using stinging nettle, saw palmetto. And so crucial, we need to stabilize insulin resistance with diet, and something that works well for support is something called berberine. Now, understand that berberine, it's a naturally occurring plant. And know this, berberine was used as inspiration for the production of some pre-diabetes and diabetes medications. It works that good. For cycle support for PMS, we wanted estrogen detox support. We want Vitex berries, we want DIM, we want to avoid the toxic estrogen impersonators, primarily plastic. Gut health, again, to support estrogen elimination, crucial, and liver support to ensure estrogen elimination. So important. Now for emotion and mood support, we want testosterone detox support. High testosterone can cause aggression. Estrogen detox support for PMS, for mood. And then cortisol herbal support along with steady blood sugar strategies is brilliant. When it comes to fertility, we think about testosterone detox support. We think about natural estrogen detox support. Progesterone creation support using the Vitex berry, using chaste berry. Chaste berry has been used for hundreds of years to stabilize cycles. And remember, we want PCOS support because why does PCS? Huge driver of fertility issues. So I want to hit that one again. Remember, there's 3 parts of PCOS. Cysts on the ovaries, high levels of testosterone, male hormone dominance that can cause cystic acne, and insulin resistance. Remember, PCOS is a top reason for infertility. They say if you have one of these, that you have the syndrome. You don't have to have just 2 or you don't have to have all 3 to qualify for the syndrome. There is natural support using berberine, as I spoke of, which was an inspiration for a lot of prediabetes and diabetes drugs. Inositol, very, very helpful natural support, as well as testosterone detox support. And remember, stable blood sugar and dietary intake. That type of counseling and support, so necessary. That's got to be a part of the strategy for PCOS. Now, when it comes to pregnancy, breastfeeding, and postpartum support, we want safe support for pregnant mom and for baby. We want to use quality prenatals, ideal as plant-based as possible, natural sources of fish oil. We always want to watch out for mercury intake, and then those crucial probiotics that keep the gut healthy. As much as possible, when it comes to pregnant mom and baby, we want to use food as medicine. Like, for example, for the nausea that can afflict pregnant parents, celery can be very effective, celery juice. The pro tip here, though, is get professional guidance. We want to give the right support as natural as possible, but professional guidance is crucial. Now, what to do for the later pattern, the emotional fluctuations, the hot flashes, the thyroid stress, the cortisol stress, the weight gain, hair loss, and more. Well, for the emotional focus and stress support, I want you to think about assessing that cortisol and the thyroid monitoring, using the dried urine test to assess the sex hormones too as well to get the full picture. Remember, the fluctuation of these hormones can cause that emotional focus and just overall demeanor support too. So important. I would say get advanced information. It leads to advanced solutions. For hot flashes, pretty simple. This is something quite reliable. Rhubarb supplementation. Sometimes it can take 60 or 90 days to finally take effect, but it's very effective. For weight gain, the hair loss, the energy, the focus, and the stress issues, thyroid monitoring and support. And when it comes to thyroid support, I really like iodine and selenium. Now, for gut health, this is crucial. You may be familiar with the gut-brain connection, the gut hormone connection, the gut immune connection, the gut inflammation connection. It is true. The gut and the brain are very, very deeply intertwined and interrelated. The gut has influence over those other systems of the body because what happens inside there is so crucial. That is ground zero. That's where good and bad things get absorbed into your bloodstream. In this gut, because of the crucial nature of what the gut does, it has power and authority over the brain to influence it, to influence the hormones, to influence the immune system and more. I'm always a fan. I always say don't guess, do a test. I'll just have you know that advanced stool testing is available, and I suggest working with a pro. This concept has become the focus of my practice, getting the gut right and honoring the gut-brain connection for ideal support and ideal outcomes. So to summarize, what do we want? Tripod of hormonal balance of the sex hormones, thyroid hormones, and cortisol, the stress hormone. It's possible. And just know finally that help is here. Advanced testing and all natural supports available. There are alternative healthcare and functional medicine trained physicians at all disciplines. This approach, along with your regular medical checkups, medical management, this to me is the complete picture to make you as balanced and as balanced, not just physically, but also emotionally through the course of life. Now, there is no cure for life. There are ebbs and flows up and down as you move through the teens, 20s, 30s, 40s, 50s, and beyond. But just know that help is here that can provide the support necessary to have a comprehensive approach to keeping you being the best that you can for yourself and for your family.